Welcome to Magical Moments, and it's all about that ease and flow and betterment in your life, folks. And I'm your host, Alena Chapman, and I've got a little magical nugget to start us out. And I'll tell you what, guys, it is time. It is time for you to start to notice what things are not serving you and give them up. I'm serious. Give them up. What is not serving you? In other words, in your day, what is draining you? Is it getting on that wonderful YouTube and watching the wonderful trial that's going on right now, or the next crisis of the day, which seems to always fill the news no matter where you go? Is it just, maybe it's caffeine? Maybe it's starch or carbohydrates. Maybe it is toxic friendship. Maybe it's even the clothes you're wearing. Yes, I'm serious. Even the clothes you're wearing. Remember, we are on this earth for a very short time. It is time for us to start to feel joy. Start to feel comfortable. Start to feel we are bringing out our best, not for everyone else, but for ourselves. And anything that is draining us, anything that is taking away our joy, our happiness, our vitality, our energy, anything that doesn't make us feel good needs to go. Now, I know there's somebody out there who's going, yeah, Alena, so I'll quit my job tomorrow. Well, all right, fine. If you want to, I'm not going to stop you. That's up to you. However, if you need that job, then, and I've been there, I've been in jobs, I didn't stay there long, but I did stay there long enough to understand what it took for me to create an environment in that job that I liked. And you can do it. You can create an environment. In fact, I even have a client that I talked to, and she found she is now she likes her job, but there was a lot of toxicity. So what did she do? She's showing acts of kindness, and she's actually getting thanked for everything she does. She's changing the environment of the whole office area that she's working in. You can do this, but you have to decide, I'm not going to accept stuff that drains me anymore. I'm not going to accept feeling mediocre. I'm not going to accept feeling like I'm not shining my best, authentic, beautiful self. I have to feel good. So this week, start noticing. That's all I'm asking. Start noticing what it is that is draining you. Okay? Awesome. Now, this is going to be, I'm so excited about this show. I am not kidding. I've been on her show, and it was really wonderful. But I am very excited about this topic, and I am so excited to have a guest that can talk about it. And it's about your health. Yes. And energy. All right? This is Dr. Lara May. I'm sorry, I'm screwing that up. Dr. Lara May. Now, she is a pharmacist and an advanced practice clinical pharmacist that specializes in functional medicine and energy medicine. She has worked in emergency rooms and acute care for decades, counseling nurses, doctors, patients, and families about medication regimes and maximizing treatment outcomes. And then she started to study and practice Reiki and energy medicine in 2014. Her passion has since grown from Band-Aid medicine, quote unquote, to growing into empowering women to truly heal themselves on the physical, mental, and spiritual levels. Now, I want you to hear the rest from Dr. Lara herself, because it's going to be an incredible interview. And hello, Dr. Lara, how are you?
Hi, I'm great. Thanks for having me. I'm so excited for today.
I am so excited to have you on. So, okay, what I really want to start to talk about, when we age, I see so many people. Well, okay, I'm young, I think. But I have to say, even when I hit 40, yes, I'm older than 40, folks. When I hit 40, I couldn't believe how many of my friends were on incredible amounts of medicine. I mean, incredible, from heart stuff to anxiety, a lot of anxiety. Everybody was on something for anxiety. All these psychotic drugs, all these diabetes, everything, all these chronic illnesses. And I don't know, I never thought aging, especially 40, number one, 40 to me is not old at all. And here people are acting like they're 80 and 90 and 100, you know? And who knows if you even need that much medication then? Where does that aging, how can we get ourselves into a place where we are aging without all this medicine in our lives and digressing into chronic illness all the time? And that's a big question to start you off, but let's dig in.
Okay, that's a great place to start.
Yeah.
So honestly, the short answer is proactivity and awareness. And when you were on my show, we talked a lot about awareness and tuning in with our consciousness and our higher self. But really, even if, and I'm sure your audience is, part of the awakened, we'll call it quote unquote awakened audience.
Oh, they're getting there. Yes, they are. I love their questions. I'll tell you, they're sharp. They are.
Yeah. But let's say you're at the beginning of your journey and you are just because I'll say I'm 42. So, I was diagnosed with IBS at the age of 23, and I ignored it for many, many years until it got to the point to where I felt like I was falling apart and I wasn't functioning at the level that I wanted to, and I was frustrated. So for me, that was sort of my turnaround point. That was what I call my bottom. And I really started to ask the questions of myself, what am I doing every day that's helping and not helping? And so we have to be willing to get real, to get honest. And like you said at the beginning of the show, you have to, in terms of feeling better, we have to commit to want to feel better above all else. And this is something that at the time, too, I was a brand new student of Abraham Hicks. And
I think we all have been
about,
there.
You're in that aha of, all I have to do is focus on wanting to feel better, and the answers will come. And so we have to start asking ourselves, how much sleep am I getting? And this was a big one that I ignored for a very long time, because at the time that my health was sort of spiraling down the drain, and at the ripe old age of, 35 at that point, way too young to be feeling so crappy.
It is. It is way too young.
I was working graveyard, and I was like, no, I sleep my solid 8 hours. It's just on the opposite end of the day. Yeah. But after doing that for so many years, I really screwed my body up. And I was in denial about that for a very long time. So we really have to just, again, be real, be honest with ourselves, and not from a place of judgment, from a place of love and compassion. And really say, okay, get to that point of forgiving ourselves for everything that we did up until this point now. This is not a time or a place to beat up on ourselves. We've done that enough. That is old school, let's just clear that right now. Now we're at a point where we want to be loving, be gentle, because getting to the energetic aspect of things, we've stored all of these things that our family has told us, that the media has told us, that Western medicine has told us, that maybe didn't jive with us, that we thought, that doesn't really resonate, but they're saying it, so it must be true. And we've stored those things in our body, in our tissues, and in our cells. The same is true for any traumas, heartbreaks, any and all of that stuff. If we haven't truly
processed
and
healed, You're welcome.
Exactly. Then we've stored it. And so this is also what is contributing to our anxiety, our depression, that I was just having a conversation with a good friend of mine yesterday about that mind chatter that goes through our head.
Yeah.
Like, where does that come from, and how do I get rid of it?
If we could understand, I'm sorry. If we could understand that this mind chatter. This is a subconscious. It comes out, all this mind chatter, and it is stemming from what we have learned that hasn't served us and the trauma. We hold on to trauma like it's a badge of honor. And yet it gets stored in our muscles. It gets stored in our joints. We are 80 or 90% water. If Dr. Emoto, who did all those wonderful photos, I actually did an interview with them, folks, if you could remember that. If you can't, go on YouTube and look, Alena Chapman, because it shows you that water inside and what you are putting your cells in. And when you are angry or you're holding that stuff, the water changes in your body, and that's the condition we're putting our whole body into. So when we are at that point, I mean, Dr. Lara, don't you think that we got to be kind to it, we got to heal it, but is that enough to change that conditioning of that water and the cells and the muscles?
Yes, because when you change your vibration, everything around you changes. And so one of the things especially that I like to do too for the energetic newbies is bring in the science, because, a lot of people think, oh, this is just woo-woo. You change vibration. Yeah. Even though those studies that Dr. Emoto did, that is verifiable science. Yep. It can be repeated.
And
so
Dr.
in the world of science,
and the showing that cells do get affected by their environment, that has been proven since 1969, Yes. And when we say proven, that means that it can be repeated in a lab and you will get a same or similar result. Exactly. So that is considered validated. And so this has been validated. And really where we are now in the world is that we know that we are all energy. We are all made up of the same elements, molecules, bonds, and that all of that vibrates at a certain frequency. And you can see it within the water if you, again, vibrate at the energy of no or anger or anxiety or sadness. Oh, it's gorgeous.
You can see those vibrations.
Yeah.
And then when you elevate your energy and you're in the energy of yes or excitement or of optimism or love or even I believe in myself, I believe in the possibility, that is a totally different vibration. And you can literally see that, again, through water. You can see it through, like, if you had a tuning fork and you, tapped it, and as you were vibrating at these other levels, if you were recording that sound vibration, you could see that reflected there as well. So when you ask, is that all it takes? It's not the full picture, but it's a really good start, because when you change that vibration, everything around you changes, like I said before. But what does that mean? That means that opportunities that weren't available to you before now open up. That means that people, resources, help, support, people that are vibrating at your similar vibration are coming to you also. So I'm sure all of us have noticed that when we're, sad or maybe we're angry at our job, we just want to vent, that we attract people that will, allow us to sort of vibrate or dwell in that vibration.
Yes.
And then when, when we can feel it, like when we're in a good mood and someone wants to come complain or vent or whatever, it just doesn't feel good, right? We're like, oh, no.
Not at all.
Well, because you're that around me.
Yeah, you're absorbing that energy. Don't absorb the energy. Well, right. When someone has a chronic illness and they're just, number one, feeling that wonderful, raising their vibration, starting to do things that make them happy, feeling like they're happy, knowing that they're healing, feeling that healing, sending love to themselves. In fact, that's a very Taoist, wonderful healing practice of pulling that wonderful energy of love in and healing. Do you believe in that visualization? I strongly do. It helps you to feel that, you can feel it start to heal your cells, your muscles, your everything, organs in your body. What do you think about that?
I absolutely believe in that, and that is one of the things that I practice. So one of my daily practices, and actually this is something that I incorporate multiple times a day, is I connect to the light. I bring source light in my body and through my cells, And then I just repeat the mantra, I love, to myself. I love, I love, I love. I love my body. I love what it can do for me. I love the sun. Just whatever comes to you, just infuse everything with love.
I like that.
You will palatably feel so much better, and you will feel yourself elevate. It can really be a powerful shift. And then if you do that, let's say every hour on the hour, or, if you're at work, head off to the restroom and just spend a minute in there connecting to the light and bringing in love. You will notice how differently people react to you, how differently you react to people and situations, how you start to refuse to take in and on all that other energy. You get to the place where you can, right, you can be in it, but not of it.
This stuff is so real, guys. When I don't get sick for very long, even a virus. And I have found that when something starts to come my way, especially, well, gosh, let's face it, my son had COVID. My mother had COVID before she died. She didn't die of COVID, but she did have COVID. And so I was exposed to it a lot. And even then I would start to get it. Now this does not mean you just forego all the stuff that can help you stay well. I did the apple cider vinegar. I took my vitamins. I took my zinc. I did that stuff. However, I still contracted it. And I still get colds and flus. You just do. But I have found that all I have to do is to see it seeping out of me. I just see it going out. I will lay down and allow it to go into some substance. I do this visualization. I just see it going out. And you can always feel where it's coming from. Every disease, you can feel where it comes from. You can feel where every virus is hiding within you. And you can just let it seep out. And then I fill my whole body with light and love. And I think that's the same thing you do. But to feel that leaving your body is one of the most incredible releasing I've ever felt in my life. Mm-hmm. It's I don't know. I'd love your comments on it. It's a very powerful, that's kind of more on the Tao. They say to breathe in all that beautiful light and then breathe out whatever's not, whatever it is, that the disease or the sickness but like I said, I don't get things very long. I just don't. I had COVID for a day and a half. But you catch it early too, But I really do work on that visualization is the most powerful thing we have as a tool. Yes,
because in order to do the visualization, we have to create the thoughts and the intention in our minds.
Yes.
And that is a huge aspect of it.
And what the mind believes is what you become, right?
Yes, and what they say, where your attention goes, the energy flows also.
I like that.
And so if you, with your intention, bring in the light and you see that illness, the sickness, the disease, the inflammation, the pain, whatever it is, leaving, then again, that is your intention. That is where you're saying, okay, body, I am going to allow you to heal. Instead of holding on to this and giving myself a label of a sickness, I am going to attach myself to the energy of wellness and health and healing and allow all the rest of that to leave. And again, that is the first step.
And that is big.
Yeah.
Have you listened to TV or if you just watch TV, I don't anymore, really. Who does? But a lot of people do, actually. And you see the ads, and all of them are on medicine. There are so many ads on taking this for your whatever, taking this for your, you don't know you have this, but this is the medicine you need.
Oh, yes. Even as a pharmacist, I find it to be one of the most unethical things.
It is.
Allow drug advertisements in this country. We're one of the few countries that actually allow it. A lot of countries, it is not allowed to advertise prescription drugs on television.
But doesn't that create a fertile mind for accepting sickness?
Yes, and that's one of the reasons I find that it's so unethical, because with these advertisements, it's planting the seed. Oh, if you have these complaints and symptoms, then you might have this and you should be afraid and blah, 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 versus, yes, be aware of what's going on in your body and definitely be asking questions and definitely be having open conversations with your practitioner, whether that be a Western medicine doctor or a naturopath or whoever. But to open yourself up to this fear of, oh my God, what if I have A, B, or C, and then go to the doctor and say, oh, I saw this commercial, I think I need this drug. Unfortunately, some doctors will be like, okay, and
You're
give
kidding.
you the prescription. And now, I mean, it's out there. Do I think most doctors do that? No, but it does happen.
Wow.
If it didn't happen, the commercials wouldn't be there.
That's scary.
The reason these commercials are there is because it's lucrative.
Everybody's into the money, it seems like. Very sad.
It's really
very sad.
But
the one thing, so we get that fertile ground, but here's the thing. If someone is trying to heal and the disease keeps coming back, then there is something in them. And yeah, it could be diet. And yes, of course, you've got to care for the body too. And that's part of the love, eating right, getting the sleep, exercising, taking care of the body. But what if that keeps coming back? So you heal yourself and it comes back. Could you possibly be holding on to something deep inside?
Oh, absolutely. Yes. Yes. So, and this is, I feel, go ahead.
That trauma, and it might not even be, trauma sounds so serious, but it can just be this belief way inside. What are your feelings on that? Because I think that's incredibly important.
Yeah, so I think the thing that a lot of us don't do is the internal investigation as to what is the emotion or the instance or the event that is attached to this disease, this chronic illness, the pain, whatever it is, the depression, anxiety. And so, again, this is where that openness to investigate comes in. And this really, I think, should require, it doesn't often require, but it should require you doing it with a practitioner to guide you through it, because a lot of us have had something happen, big T, little t, traumas, whatever. A trauma is something that doesn't even have to be that big or horrible, but it put us on a trajectory of either fear, anger, hiding, and then, shutting down or changing something about ourselves from how we were before, right?
Right. I'm trying to think of an example. Maybe if someone was, and I actually have seen this, if someone was bullied in school.
Right. That was the example I was just about to bring forward.
Oh, were you? Great minds. So if that person has, that bullying in school, and then what do you find later in their life? Are they bullied again? It comes back. And then what does that cause in the body?
Yes. And that depends on where the person stored it. So this is where the investigation and the working with the practitioner comes in. And again, you can do this on your own, but for people that do it on their own, I feel have a very strong energetic meditation practice going into it. So they're able to hold space for themselves.
It's good to always talk it out. People, especially with someone who knows what they're doing, because if you do that, then when you talk it out, they can bounce back. When I first began in this field, I had a wonderful intuitive person who got me started. She helped me to get over some of the blocks I had about even doing what I wanted to do, right? Because it was someone to talk to. I never say, just, you're okay by yourself. I always think it's good to have that person to bounce ideas off of and get clarity that you might not be in the place where you can have that clarity yet, I think it's, how can people learn more about you? This half an hour goes so fast.
It does. So my website is drlaramay.com, drlaramay.com. I am across social media at Dr. Lara May as well. So Facebook, Instagram, Twitter. I have a YouTube channel that has all my past podcasts. My podcast is Light Body Radio, and it's on, I think, almost all the platforms, if not all the platforms. And
they can check out our interview.
I'm out there.
Yeah, you can go there. And I was
yeah.
interviewed by Dr. Lara myself, so you can check that out. That's fun. Yeah, and all her other stuff. Very cool. I think our health is one thing that we have that is so very important. And if we treat ourselves well and start to, deal with the stuff we need to deal with. Everyone thinks working on ourselves is, I've heard the term, it's so selfish, and you're supposed to, I don't want to deal with all that. I don't want to take that responsibility. However, guys, it's you. And the only thing keeping you on this planet is this physical form. And so why not live well? Why not live until you're 100 or more? Why not feel good the whole time? Is it possible? Yes, it is. But we just have to become consciously aware. And for everyone out there, hey, look up YouTube Alena Chapman. And we're all about soul wisdom. And every time we get all the shows are there. From this one, Magical Moments is all there. Other podcasts that I do is there, Soul Manifesto, plus all the value videos. And if you're interested, just look up Alena Chapman, nice and easy on that YouTube. And also check out all the other Twitter and everything else. It's all about soul wisdom. Everything I do is about tapping into that soul wisdom. Live well, live happy, and get rid of what doesn't serve you. Let that beautiful spirit enter in through the love you're showing yourself and others.